All right, guys, so let's talk about chapter 20, which is going to discuss immunologic emergencies or allergic reactions. So, this, as I have said many times before, is going to be the EMT's bread and butter. That means that there's a lot that you can do here, and even where we're going to talk about sometimes that you might need ALS, there's still a lot that can be done at the EMT level, so don't count yourselves out from that. So we're going to talk about some differences between a localized allergic reaction, like a mild reaction, and what classifies as a systemic anaphylactic type reaction. A lot of these things are going to be related to the airway and also the cardiovascular system, like with widespread vasodilation, causing potentially cardiovascular collapse. Again, there's a lot that you can do to treat this life-threatening complication, even at the EMT level. But it's really important that you be able to differentiate what is the difference between this localized reaction, what's the body's normal response, and what is an allergic reaction. It's just the same as if you were to get a shot. Okay, when you get a vaccine of any kind, your body has some type of reaction to it, whether that's, a site reaction, it becomes red and painful at the site, you might run a low-grade temperature. That's your reaction to the vaccine versus an actual allergic reaction, or that becomes systemic. So looking at some anatomy and physiology, the immune system itself is there to protect the body from foreign substances and organisms. So when something invades this and it sees it as a threat, then the body's going to go on alert. And it begins to initiate a series of responses to inactivate this invader. And that happens through a response in the body that is going to produce chemicals. And those chemicals are going to produce the changes that we see happening with an allergic reaction. So this allergic reaction is an exaggerated immune response to any substance. And it's important for us to remember that this is not caused directly by the stimulus. It's not the stimulus itself that is the problem. So for example, if you're allergic to peanuts, it's not peanuts that are the problem. Okay, it's your body's response to those peanuts that is the problem. Peanuts are not an issue for everybody. They're only an issue to those people that have this exaggerated immune response to those substances. And that goes for everything. It could be grass, it could be flowers, pollen, it could be dust, pet dander, foods. It could be any number of things. But it's important for us to remember that it is the stimulus that is not the problem. It's the body's response to it. So again, this is caused by the body's immune system that releases those chemicals to help combat that stimulus. It sees it as a threat. It wants to get rid of it and break it down, but the body actually begins to attack itself in trying to get rid of it, which can be just as dangerous. Some patients may not know what's causing their reaction, especially if this is their first time experiencing it, and that certainly can be the case. You can develop allergies later in life. You can, be totally fine with eating foods until you're 30 years old, and then suddenly you have a new onset of allergy to it, or a newly developed allergy. And you can also grow out of allergies. So if you are allergic to something as a child, it doesn't mean that you're necessarily going to be allergic for life. So that requires follow-ups and things like that. But again, people may not know that they're allergic to anything, especially if this is their first exposure to it. So important that we be able to do a thorough assessment, that we can recognize the signs and symptoms, and that we keep a high index of suspicion. And remember, that index of suspicion is what is going to let us know that what are the red flags here? What am I staying alert to? And that's what we have to do in this situation, is to look at the whole picture. What did they recently have to eat or drink? What have they recently come into contact with? Is any of this new, or the first time that they've ever been exposed to it? All of these really important questions to ask to put those puzzle pieces together. Allergic reactions can be mild and local, or severe and systemic. So we've talked about this previously, but just to reiterate, if you come into contact with a substance in the area that you come into contact with, it becomes red or itchy. So I would just use a plant for an example. All right, so a plant brushes against your arm, and where that plant touched you specifically starts to turn red and it itches. Maybe you get a few hives there, but you have no difficulty breathing, no swelling of your airway, no hypotension, no hives anywhere else in the body, and in general you feel well, then that's going to be a mild localized reaction, localized to the site that it occurred. It could also be severe and systemic, and that's where anaphylaxis comes into play. So this is where you start to see hives in areas that were not actually affected. You start to to see hypotension, you start to see bronchospasm or wheezing, you start to see swelling of the airway, angioedema, swelling of the face, lips, and tongue. So those are the things, some of the things that we're looking at for it to be considered anaphylaxis. And again, it doesn't have to be all of those things. That's a textbook presentation, but any one of those things on their own in conjunction with the possibility of coming into contact with an allergen is, enough for us to consider this anaphylaxis. So this is essentially the body's response to anaphylaxis, what's happening inside of the body. Again, it does involve multiple organ systems. That makes it systemic, so it's not just limited to one area. And it can rapidly result in shock and death. This is our fastest progressing form of shock. Remember, others like sepsis can take days or even weeks to fully form and move into decompensated shock, but with anaphylactic shock, this can happen in a matter of minutes. Okay, usually in just a few minutes, we can start to see these life-threatening signs and symptoms. So very important that we recognize it early and that we treat it early and appropriately. So again, just in this picture, they're showing you what happens. And in this case, this was a bee sting. So the actual bee sting occurred. The antigens came into play, and then the chemicals begin to be released, trying to fight that off. But what's happening because of that chemical production are these signs and symptoms that we're actually going to see in the body. And so with the lungs, we start to see vasoconstriction and bronchospasm happening here, meaning that we're hearing wheezing and we are not making adequate oxygen and carbon dioxide exchange. We're not making good blood exchange due to the vasoconstriction. The heart is having decreased cardiac output and decreased coronary flow, and that in conjunction with the widespread vasodilation and leakiness of the blood vessels is going to result in hypotension because of that widespread vasodilation. We're also going to start to potentially see swelling as blood begins to pool in those beds. And then with the skin, we could have itching, we could have urticaria or hives, we could have swelling and edema, it could be flush, red skin. So those are the things that we're going to see there in response to these chemical release. So 3 of the most common signs of anaphylaxis are urticaria, which is hives, which is what you see in the top picture. Angioedema, which is what you see in the bottom picture, which is potentially swelling of the face, lips, or tongue, and then wheezing. All right, so we can also throw in hypotension here as well. And when we see any of these things, and that urticaria, meaning that it's widespread or somewhere that it did not come into contact with. Obviously, like I said, if something touches your skin topically and that particular area has hives and it's only limited to that area, we would consider that local. So we're looking for this to be more widespread. Again, patients can also experience hypotension due to the vasodilation and increased capillary permeability. And sometimes they can also have gastrointestinal dysfunction like nausea, vomiting, and severe abdominal cramps. Usually this could be a first sign of a food allergy if this was something that they took in by mouth, but it could be coming from something else as well. It could be, the nausea, vomiting can be coming from an injection or a sting or something like that as well. So looking at some common allergens, food is definitely a big one. The symptoms here may take more than 30 minutes to appear, just depending on what it is and how severe the allergy is. 2 of the most common are shellfish and nuts, but people can really be allergic to anything. People can be allergic to milk, to eggs, to spices, to certain meats or vegetables. It really can be anything. And some people, the allergen is so severe that whenever they come into contact with it, as soon as they take that first bite, or even for some people being in the same room with that particular allergen, can be life-threatening. With medications, if it's injected, this is probably going to be immediate and more severe as this is going directly into the bloodstream. But for oral medications, it can take maybe up to 30 minutes to appear since it does have to be broken down and absorbed by the body. Other things to consider: plants like dust, pollen, plant materials, ragweed, ryegrass, maple and oak, chemicals like makeup, soap, hair dye, latex. That's a big one for healthcare providers. So usually we will utilize nitrile gloves or latex-free gloves just to avoid that if someone does have a latex allergy. And then, of course, insect bites and stings. That process of injecting the venom is called envenomation. So thinking about like bee stings, fire ant bites, things like that, where venom is actually injected, that's called envenomation. And this reaction could be localized or systemic as well. Usually when we think about insect bites, it could be systemic. But if you think about, even if you're not allergic to fire ants, but you experience a swarm of fire ants biting your feet or legs, and that itching and the hives that come there, that is technically an allergic reaction that's happening within the body. And so if that doesn't spread and cause those life-threatening signs and symptoms, we would still consider that localized. But you could treat it with Benadryl, which we're going to get into treatment here in just a few minutes. So looking at insect stings, approximately 3% of adults and 1% of children are allergic to the venom of bees, wasps, and hornets. These insect stings cause about 50 deaths per year in the United States. The stinging organ of most insects is a small hollow spine projecting from the abdomen. Now, depending on what it is, means, how many times can it sting in its lifetime. So honeybees, for example, cannot withdraw their stinger. So that means that's it. They get one sting and then they fly off and die somewhere. So they better make it worth it, right? Wasps and hornets, they can sting multiple times, and that could be multiple times within its life or multiple times on the same victim, because they can withdraw their stinger. Some ants, especially fire ants, can strike repeatedly as well. This doesn't really affect their life cycle. So in this picture here, all of those multiple bites, that could come from one ant, or it could come from multiple, happening really quickly. And that's a pretty common reaction that you would see from fire ant bites if you've never experienced them before. So signs and symptoms of the insect sting: sudden pain, swelling, localized heat to the area, and really that's coming from all of these chemicals being released and everything swarming to that area to really try to fight this off. Urticaria, which is hives, redness and light-skinned individuals, and also itching and a wheal. So the wheal is just what you see here in that one picture, and I think we can all agree we've probably experienced that for ourselves at some point in our life from a bee sting or maybe even a mosquito bite, where the point of the bite or envenomation is actually where you see that raised area. Now, if you have multiple of these, then that's where we would call that hives or urticaria. But if it's just simply one at the point of envenomation or the bite, then that would be considered a wheal. So just knowing the difference between those terms. Now, in a severe anaphylactic case, the patient might experience bronchospasm and wheezing, chest tightness and coughing, difficulty breathing or dyspnea, anxiety, gastrointestinal complaints, like we said, nausea, vomiting, abdominal cramps, hypotension, and they may occasionally experience respiratory failure. So if untreated, an anaphylactic reaction can proceed rapidly to death, and that's very important for us to remember, that we've got to intervene appropriately, we've got to intervene quickly, or this is going to proceed into death. The body really can't stop its reaction once it's crossed that threshold of anaphylaxis. So very important that we are able to get the patient the correct treatment. I'm going to stop this video here, and I'll catch you guys in part 2.